Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been experiencing these sharp pains in my left temple, almost like lightning bolts. It's quick but intense, and during these moments I feel like everything just blacks out for a second. It's not frequent, but when it happens, it's frightening. The last episode was about 2 weeks ago. I'm also dealing with this burning sensation in my legs and shortness of breath when I walk more than a couple of blocks or climb stairs. It's odd because I seem to do fine on a treadmill when I'm at rehab.
I see. Tell me more about these episodes of pain in your temple. How long have they been happening? And about your leg burning and shortness of breath. How long has this been a concern?
The sharp pains started around 3 months ago. They're very sporadic, maybe once every few weeks. As for the leg burning and shortness of breath, I've noticed it gradually getting worse over the past 6 months. I thought initially it might just be part of getting older and all the stress from my recent surgeries.
You mentioned surgeries and hospital stays. Can you tell me more about your recent medical history and those experiences?
Sure. Over the last year, I had a couple of surgeries related to my heart condition and the bypass I had. Recovery has been tough, and being in and out of hospitals just drains me, contributing to the fatigue I feel, especially in the mornings. And with all these medications, I'm also concerned about the impact they might be having on my sexual health. I've been having trouble with maintaining erections, which I think might be tied to the venlafaxine, or perhaps just the overall strain on my cardiovascular system.
Understood. It's good that you're monitoring these symptoms closely. We'll definitely review your medications and discuss their potential side effects. How are you managing your day-to-day activities with these symptoms?
I'm trying to stay active and involved, especially with family events coming up. I still go to rehab and do what I can around the house, but some days are just harder than others. I'm also a bit concerned about the long-term effects from the Agent Orange exposure during my service. I've read it can lead to several health issues.
That's a valid concern, and we're keeping that in mind as we monitor your health. How about your diet and overall lifestyle? How are you managing those?
I've been trying to eat healthier, more fibers as you recommended last time, and using personal wipes to manage the discomfort I sometimes get with bowel movements. It's manageable, but I'm always looking for ways to improve.
It's good to hear that you're taking steps to maintain a healthy lifestyle. Let's discuss your recent health screenings and clinical results to better understand the next steps.
Please, let's do that.
Based on the information and symptoms you've shared, The sharp pains in your temple could be trigeminal neuralgia, especially given their intensity and brevity. However, we'll need to conduct further tests to confirm this. Your leg pain and breathing issues might be related to peripheral artery disease, which isn't uncommon in heart disease patients. Your ECG and echocardiogram are reassuring, but we'll keep a close eye on these symptoms. Your lab results are mostly within normal limits. Your hemoglobin, hematocrit, and cholesterol levels are good, and your liver and thyroid functions are normal, which is excellent. Given your heart condition and the medications you're on, it's crucial we balance managing your cardiovascular health while addressing these new symptoms. Here's our plan. We'll schedule an MRI to investigate the sharp pains in your temple more thoroughly. I recommend seeing a vascular specialist to evaluate your leg symptoms and shortness of breath. We'll review your current medications in detail, especially venlafaxine, to address your concerns about sexual function. Continue with your cardiovascular rehab and the exercises tailored to your condition. We'll meet again in 6 weeks to review everything unless your symptoms change significantly before then. Please keep a symptom diary that could help us both understand the patterns better.
Thank you, Doctor. It's reassuring to have a clear plan and to understand more about what could be causing these issues. I'll start that symptom diary today.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've been managing since the last time I was hospitalized, but it's been a bit challenging. My mobility was quite limited for a while, though I'm starting to walk a bit more around the house now.
I'm glad to hear you're starting to move around more. How has your overall recovery been going since your hospital stay?
It's been a slow process. The prednisone helped initially with the inflammation, but tapering off has been tough. I've been feeling more fatigued lately, and my muscles seem weaker than usual. My last dose of prednisone is scheduled for the 25th, so I'm a bit anxious about how I'll feel once I'm completely off it.
It's understandable to feel anxious about coming off the prednisone, especially after depending on it for relief. How have your blood sugar levels been with your insulin therapy?
Managing my diabetes has been another challenge. I use glargine at night and aspart during the day, depending on my glucose readings. My fasting levels have been fairly stable, but it fluctuates quite a bit post-meals. I've been trying to stick to the dietary advice from the dietitians about a low-fat, low-sodium diet.
Good. It's important to keep your diet in line with your diabetes and kidney conditions. Speaking of which, have there been any changes or concerns about your vasculitis or other symptoms?
Yes, I still have that persistent rash that was thought to be linked to vasculitis. The rheumatology appointment is what I'm hoping will give us more answers. I should be seeing them in the next few weeks. The rash can be quite uncomfortable, and sometimes it feels like it's spreading.
Let's make sure that gets looked at soon. Maintaining your mobility and managing the rash are important. How have you been managing with your exercises at home?
I do what I can. I've been following the home exercises the physical therapist recommended. It helps a bit with the stiffness, and I think it's been good for my overall strength, even if progress feels slow.
It's great that you're keeping up with the exercises. Maintaining physical activity will help with your strength and can also impact your overall health positively. How has your weight been?
My weight has remained stable, which I guess is good news. I haven't had much appetite change, which helps keep my diabetes more manageable.
Stability in your weight is definitely good, especially considering your conditions. Now let's review some of your recent clinical values to better understand your current health status. Your blood pressure is on the lower side at 90/60 mm Hg, which we'll keep monitoring. Your latest lab tests show your blood glucose levels are fairly controlled, with fasting at 112 milligrams per deciliter and postprandial at 145 milligrams per.
That's relieving to hear. I do worry about my kidney function, though.
Yes, your creatinine is at 1.9 milligrams per deciliter, indicating some stress on your kidneys, and your blood urea nitrogen is at 44 milligrams per deciliter. We'll continue to monitor this closely, especially with your diet and medications. Your liver function tests are normal, which is good, and your inflammation markers like C-reactive protein at 5.2 milligrams per deciliter and erythrocyte sedimentation rate at 20 millimeters per hour are slightly elevated, but not alarmingly so.
It seems there's always something to keep an eye on. What should we do moving forward?
For now, we'll continue monitoring your health closely. Your vasculitis needs further evaluation by the rheumatologist, and we should continue your current regimen of insulin therapy. Keep up with the dietary management and make sure to stay active with your home exercises. We'll schedule follow-ups after your rheumatology appointment to reassess and adjust your treatment as needed. It's crucial that we manage these symptoms comprehensively to avoid any complications.
Thank you, doctor. It's a lot, but I feel better knowing we have a plan and that you're keeping a close eye on everything.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Have you reviewed the new data on immunotherapy for stage 4 melanoma? The latest trial results suggest a significant increase in 5-year survival rates.
Yes, I have. The combination of CTLA-4 and PD-1 inhibitors is showing promise. However, I'm concerned about the neurotoxic effects and autoimmune responses reported in some patients.
Those are valid concerns. The key might lie in patient selection and genetic profiling to identify who could benefit most without severe adverse reactions.
That's a good point. Also, we need to consider the economic implications. These treatments are highly expensive, and not all insurance plans cover them fully.
Absolutely. Maybe we should collaborate with the Bioethics Committee to develop guidelines that can help prioritize patient access based on clinical need and potential benefit.
I agree. Furthermore, developing a follow-up protocol for monitoring long-term outcomes and side effects in real-world settings could help refine treatment protocols and patient education.
Now look at question 26.
The recent uptick in multi-drug resistant TB cases in our facility has been concerning. Have you looked into the genomic sequencing reports?
I have, and the diversity of resistance genes is higher than expected. We might be dealing with a previously unidentified strain, which could complicate treatment significantly.
That's troubling. Perhaps it's time to consider an overhaul of our infection control protocols. Incorporating routine genomic surveillance could help us catch these cases earlier.
Indeed. Also, integrating AI-based predictive models to analyze patterns of drug resistance could help us preemptively adjust our therapeutic approaches.
That's an innovative approach. We'll also need to train our staff on the use of these new technologies and ensure compliance with updated protocols.
Training is essential. Additionally, setting up a multidisciplinary task force could provide ongoing review and adjustment of our strategies based on latest data and outcomes.
Now look at question 27.
Sarah, have you reviewed the implications of the new FDA guidelines on our clinical trial design? They seem to require a more comprehensive data collection on patient outcomes.
Yes, Brian, I've been looking into it. The guidelines now demand real-time monitoring and reporting of adverse events, which will definitely increase our workload and necessitate upgrades to our IT systems.
I was concerned about that. Do you think we should start training our clinical staff on these new protocols immediately, or wait until we've updated our systems?
It might be prudent to begin training in phases. Starting with a pilot group could help us identify any gaps in our understanding or infrastructure before a full rollout.
Good idea. I'll arrange a meeting with the IT department to discuss the systems upgrade. We need to ensure compatibility with the new data reporting requirements.
Let me know the outcomes of that meeting. Meanwhile, I'll draft a preliminary training schedule and circulate it for your feedback.
Now look at question 28.
Emily, there's been an update in the neuro-oncology protocol, especially concerning the use of biomarkers for glioblastoma treatment stratification. Have you seen the latest journal article on it?
Yes, Jason, I've read it. The article discusses the integration of new molecular biomarkers that could significantly alter our treatment pathways, potentially improving survival rates.
That's promising. How do you suggest we integrate these findings into our current practices? Should we start by revising our biopsy techniques to ensure we're capturing the necessary data?
Absolutely. We might also need to collaborate with the genetics lab more closely to streamline the analysis process. Ensuring timely results will be crucial for effective treatment planning.
I agree. I'll set up a meeting with the lab team and the department heads to discuss how we can fast-track this integration. It's crucial that we stay ahead in implementing these advancements.
I'll prepare a summary of the article and the potential impacts on our treatment protocols. It'll help in making our discussions more fruitful and focused.
Now look at question 29.
The new protocol for managing acute myocardial infarction incorporates the latest thrombolytic therapies. Have you had a chance to review the updated guidelines?
Yes, I've gone through them. The integration of enhanced imaging techniques to assess myocardial viability before thrombolysis is particularly impressive.
Absolutely. And the new algorithm for risk stratification should help us tailor interventions more precisely. However, the guidelines require significant training for the staff.
That's true. Training will be crucial, especially in our rural branches where resources are limited. It's going to be a challenge ensuring that all staff are up to speed.
It might be worth considering a phased training approach, focusing on high-volume centers first. What do you think?
That sounds like a practical approach. We could also utilize virtual training sessions to reach more staff members efficiently.
Now look at question 30.
Emily, the new protocol for early sepsis detection using biomarkers in the emergency department is showing some promising early results. Have you had a chance to review the data?
Yes, Jason, I've looked at the initial findings. It seems the biomarkers can indeed identify sepsis several hours before clinical symptoms become apparent, potentially saving lives.
Exactly. The challenge now is integrating this testing into our triage system without causing delays. Any thoughts on how we could streamline the process?
We could consider a dedicated fast-track lane for high-risk patients, where these tests are performed as a priority. This would require some retraining for the triage nurses and maybe additional staffing during peak hours.
I like that approach. Implementing it could not only improve patient outcomes, but also reduce ICU admissions significantly. Let's draft a proposal and present it to the management team.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Good afternoon, everyone. Today, I am thrilled to delve into a complex and pertinent topic that impacts us all: the intricate relationship between environmental factors and skin aging. This exploration is not only relevant, but essential, as it informs our understanding of dermatological health in the context of an increasingly polluted world. Let's begin by discussing a groundbreaking study conducted by researchers from Harvard University, which was published in the Journal of Clinical and Aesthetic Dermatology. This study meticulously analyzed the effects of air pollution on skin aging among populations living in urban environments. The research focused on a cohort of 500 individuals over a 10-year period, tracking environmental exposures and their dermatological consequences. The findings were alarming yet enlightening. Participants exposed to higher levels of particulate matter, PM2.5, and nitrogen dioxide, NO2, which are common pollutants in urban air, showed significantly accelerated signs of skin aging. These signs included increased wrinkle formation and a noticeable decrease in skin elasticity. The study employed a multifaceted approach to quantify skin health, using both dermatological assessments and biochemical markers of skin aging. The researchers noted an increase in matrix metalloproteinases, MMPs, enzymes that degrade collagen and other structural proteins in the skin correlated with higher pollution levels. This enzymatic activity suggests a direct biochemical pathway through which pollution damages skin integrity, leading to premature aging. Now, let's apply these findings to a hypothetical patient, whom we'll call Jane. Jane is a 45-year-old woman living in a bustling metropolitan area. She has begun to notice more pronounced wrinkles and a decrease in skin tautness over the past few years. Concerned, Jane consults a dermatologist who, aware of the recent Harvard study, considers environmental factors as a potential aggravator of her skin condition. The dermatologist recommends a comprehensive skincare regimen tailored to combat the effects of environmental pollutants. This regimen includes the use of antioxidants such as vitamin C and E, which have been shown to counteract oxidative stress caused by pollution. Additionally, Jane is advised to incorporate sunscreens with a high SPF to protect against UV rays, which can exacerbate pollution-related skin damage. Further, Jane's dermatologist suggests altering her skincare routine to include products that strengthen the skin barrier, like ceramides and niacinamide. This strategy is aimed at reducing the penetration of pollutants into the skin layers. Jane is also advised to consider lifestyle modifications, such as using air purifiers at home and minimizing outdoor activities during peak pollution hours. The Harvard study not only sheds light on the impact of environmental pollutants on skin aging, but also underscores the importance of integrating this knowledge into clinical practice. For dermatologists and skincare professionals, staying abreast of such research is crucial for providing patients with informed, effective care. It also highlights the broader implications of urban living on health and encourages a multidisciplinary approach to tackling the challenges posed by environmental exposure. Thank you for your attention. I look forward to any questions you may have about how we can further integrate these insights into our dermatological practices and daily lives to mitigate the impacts of environmental aging on our skin.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I'd like to discuss an increasingly relevant and complex topic in the field of reproductive health: advances in fertility preservation and the implications for women with cancer. Given the rise in both cancer prevalence among younger populations and the advancements in cancer treatments, fertility preservation has become a critical issue for many women diagnosed with cancer during their reproductive years. Fertility preservation represents a significant interdisciplinary challenge, integrating oncology, reproductive medicine, and ethical considerations. One pertinent case study involves a 29-year-old female patient, referred to as Jane for confidentiality. Jane was diagnosed with early-stage breast cancer, which required chemotherapy that could potentially harm her ovarian reserve. Before beginning her cancer treatment, Jane consulted with a fertility specialist to discuss her options for preserving fertility. This step is crucial because it offers patients like Jane the possibility to conceive post-cancer treatment. Jane decided to undergo ovarian stimulation followed by oocyte retrieval and cryopreservation, a process in which eggs are harvested and frozen for future use. This procedure had to be carefully timed and coordinated with her oncology team to ensure that it did not delay her cancer treatment. The use of letrozole during ovarian stimulation minimized her estrogen exposure, which is particularly important in estrogen receptor-positive breast cancer, like Jane's. This case illustrates several key advancements in the field. First, the integration of oncofertility, a term that encapsulates the intersection of oncology and reproductive medicine, has enabled personalized fertility preservation strategies. Second, the application of protocols that consider the type of cancer and its treatment in fertility preservation reflects a nuanced understanding of the patient's medical and personal needs. However, this interdisciplinary approach also raises several ethical considerations. The primary concern is the need to balance the urgency of cancer treatment with the time-sensitive nature of fertility preservation. Moreover, there's the psychological impact on patients who must make quick decisions about future fertility in the face of a life-altering cancer diagnosis. Discussions about potential treatment risks, success rates of fertility preservation, and future pregnancy also play a critical role in patient counseling. In recent scholarly discussions, such as those documented in Harvard Medical School's publications, the focus has been on refining fertility preservation techniques and protocols to improve efficacy and safety for cancer patients. Research continues to evolve in areas like ovarian tissue cryopreservation and the use of gonadotropin-releasing hormone, GnRH, agonists to protect ovarian function during chemotherapy, expanding the options available to patients. Fertility preservation for cancer patients is a prime example of how personalized medicine is being implemented in reproductive health. For healthcare providers, staying informed about the latest advances in this field is crucial to effectively counsel and support patients like Jane. By fostering a multidisciplinary approach and addressing the ethical dimensions, we can better serve our patients' diverse needs, ensuring they have the opportunity to pursue parenthood after surviving cancer.